Hello, everyone, and welcome to this audio podcast. As part of as part of a another as part of another radio edition under Storm Robotics production. This audio podcast is this audio podcast or this audio podcast series is a Storm Robotics production as a Torpedo Storm and a part of the Storm Richter and this audio podcast particularly is an overview or a synopsis in around this audio podcast this Storm Robotics audio podcast series. So this synopsis will look at an overview in around published works from 2018 and looking at a sort of service evaluation in young people suffering with chronic kidney disease or CKD. The original works have been peer reviewed and published have been peer reviewed and published and collaborative from in around 2018, and this audio podcast series will sort of into aspects of the peer reviewed publication wherein there will be there will be some added context in regard to the general theme of this peer reviewed and published works, but also looking at the use of sort of social media platforms in context of research and awareness, and in context of opportunities for healthcare, opportunities for sort of researchers, investigators, but also for healthcare professionals in context of the use of social media and opportunities for health for general for aspects pertaining to the themes of this works and aligned to healthcare healthcare services sort of specifically, but also generally. So a little bit in around this works in aligned to the aligned to the in line to a synopsis. So health economics plays an increasingly important role in the assessment of cost effectiveness in healthcare, providing input into health tech assessments and clinical guidelines developed for clinical commissioning groups or CCGs. Typically, it has proved challenging. It has proved challenging to assess the cost effectiveness of services for younger patient groups due to the lack of data that would typically populate economic that would typically populate economic evaluations. So whilst society may, on the one hand, value treatment priority for young people, a more thorough evidence base is required to support care. At the same time, at the same time, evaluation of costs and benefits in context of an economic evaluation framework could aid decision makers as to how best to treat those in younger sort of patient cohorts. So the original peer review works looks at and highlights that sort of looks at looks at aspects aligned to the importance of young people and in context of healthcare and service evaluation in context of a specific sort of healthcare healthcare um, condition. Um, so the in the original works, but also as part of this audio podcast series, there will be there will be an overview in around some data from the UKRR, or the UK renal registry, to explore how service evaluation and pediatric health practices can be enhanced through a better understanding of social and clinical social and clinical care networks. The emphasis is on the clinical care networks. One such example in context of social media platforms, or two such examples in context of social media platforms, include the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDOS, for kids, where service providers and service users have opportunities have more opportunity to share discussions in and about the participation in context of how of in context of healthcare. And additionally, as part of this synopsis, to inform that there has been a fragmentation of service between centres, while between pediatrics and young people's healthcare divisions in context of services. So whilst one centre or region may provide most young people services for CKD or chronic kidney disease, another may offer limited services. This delivery of services can also depend somewhat on where a young person, where young persons live or lives, which is also reflected by the investment and priorities of that area, making it a challenge for young people to receive the best care, sort of sort of more generally, and some there is some works that have been published by the Royal College of Pediatrics and Child Health in the United Kingdom, sort of from 2011 and more recently. At the same time, some patients or recipients with pediatric kidney diseases or renal diseases reported high incidence of conditions for example, renal dysplasia and reflux, obstructive uropathy, and glomerular disease or diseases, and these were the most sort of common listed renal diseases for younger patients aged 16 years old, with CKD, chronic kidney disease, generally and accounted for around just under 63% of all patients of whom primary diagnoses had been reported. So in as part of this synopsis as well. Um, understanding sort of costs and remunerations of where a value can be added in the care of young people with chronic kidney disease or CKD. Um, would aid both service providers and decision makers with how to provide and or integrate the best care for this sort of patient cohort. Research has been developing on how best to detect CKD in young people, looking at which patients are affected and what the optimal monitoring intervals are between blood tests, for example, and when is the right time for referral to specialist care. And prospective works, at least in 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 literature, has informed um, prospective research. We need to identify sort of the skills, the competencies, and the sort of added value to support patients or recipients who have CKD. Um, and so, whilst again pediatric renal teams do make valiant efforts to know when and how young people with CKD may benefit from alternative treatment or care pathways. There is a need for good examples in practices, so colleagues can see firsthand. So collaborators, researchers, investigators, for example, can see firsthand what best practice should look like or looks like. Learn and looks like, but also learn more effective ways to demonstrate and document evidence-based practice and practices, and also and ultimately highlight service gaps. So this so th- so services so where services are required, um, the fragmentation aspects are better understood. That draws this synopsis in around this audio podcast this audio podcast as part of a sort of overview as part of the Pathogenesis edition. This is an audio podcast as part of the Torpedo storm and the storm Richter, and this is an audio podcast as part of another Storm Robotics production audio podcast series. Thank you.